Okay, finally got it to go back. So today is the completion of the reproductive section. Reproductive systems 2, so we're going to cover all of the rest of the story, including STIs, sexually transmitted infections. Moving onward, ovarian cysts. They're relatively common. An ovarian cyst happens when you start developing a primordial follicle into a primary follicle or a Graafian follicle, and it never quite makes it, so you can't ovulate. Instead, you still have the egg in there trying to develop and trying to do its thing, and it forms into a cyst, which can be fairly large. You can have a follicular cyst, which is the follicle before it got the circle of cells around it that turns it into a luteal phase follicle, which has the corpus luteum around it. The corpus luteum could actually form a cyst on its own. Dermoid cysts are an egg that actually tried to grow into an embryo. And you'll see teeth, you'll see bones, you'll see little bits of body parts in there that tried to develop into a fetus. Another type of growth is an endometrial polyp. The endometrium, of course, is the inner layer of the uterus. And kind of like polyps on the colon, they grow inward. They can start out benign and become cancerous later. They might need to be removed as soon as you can find them. They can cause pain during menstruation. They can cause excess bleeding because the wall of the uterus is not allowed to slough off properly as it's supposed to. Leiomas, leo means leiomyoma. A leioma is a smooth tumor. A leiomyoma is a smooth muscle tumor. So myo is muscle, leo is smooth. Smooth muscle tumors, what these are is the myometrium, the middle layer of the uterine wall is muscle designed for contraction during childbirth. And these can grow into tumors that can get this big. They can be very painful. They can be very difficult to manage. And they're also called fibroids. That's the more common name for them. They grow in the myometrium, and they grow bigger and bigger and bigger. Again, pain, uterine bleeding. I may have mentioned the friend of mine who had a fibroid tumor for years and years that went undiagnosed. By the time they took it out, it was the size of a grapefruit. There are a couple of things that you can do to try to get rid of fibroid tumors or leiomyomas. One is you can cut them out, which is commonly done. Another is what they call uterine fibroid embolization, or UFE. To create an embolus means to block off the blood vessel leading to it. So they find this new little blood vessel, because tumors love to create new blood vessels to make sure they have plenty of blood. If you can find out the one that is supplying that fibroid and you inject some kind of a blocking substance into there, some kind of a gel or something that will block blood flow, you can starve the tumor to death. And that's another treatment for these guys. Here's a fibroid. Actually, that's what a fibroid looks like. In this case, they're showing yet a different kind of growth that can go in there. And this is where in the muscle you get some endometrial tissue growing. Now, this looks like a fibroid because they don't really get, normally an adenomyoma doesn't get this big. Adeno means gland, and so leo would be smooth muscle, but this is a condition in the muscle of glandular tissue. which describes the endometrium, which secretes a lot of hormones and stuff. So if part of this endometrial tissue migrates into here and starts growing inside there, it's usually non-functional tissue. It just gets in the way of the muscle layer doing its job. So it can be asymptomatic, or it can cause, especially if it pushes enough and doesn't allow endometrial sloughing during menstruation as it should, then you have extra pain and you have extra bleeding and maybe not a complete clearing of the uterus during menstruation. Endometriosis is the one people know about. Adenomyosis, this tissue is just moving into the adjacent layer and growing there even though it doesn't really respond to hormonal changes during menstruation. Endometriosis is when this endometrial tissue, which is, man, they're almost like stem cells. Every month you grow a whole endometrial layer ready to accept an implanted fetus, an implanted egg to grow into a fetus, and then it sloughs off during menstruation and you start over again. These are really fast-growing cells. They're very active cells, and they can sort of metastasize. They're not cancer cells, but they can sort of act like them. They metastasize. They can go up the fallopian tube and go out that way. They wind up affixing themselves to structures all throughout the pelvic region and even up into the abdominal region, and they actually grow and work. So when the hormonal changes happen during menstruation, these guys start secreting hormones and start doing stuff, and it hurts. I have a friend in Atlanta who had endometriosis so bad she had multiple surgeries to remove these endometrial growths from various organs inside her body. Your own immune system is supposed to reject abnormal cells growing on there. I mean, they should keep cancer cells from metastasizing there. They should keep endometrial cells from metastasizing there. Sometimes they don't do their job. Cervical cancer, almost always caused by the human papillomavirus, the HPV virus. HIV too, because HIV and especially AIDS drops the immune response to the point where opportunistic cancers can take over. And so cancer cells that were held under control by your own immune system suddenly are allowed to flourish. And cervical cancer is one of the more common reproductive cancers that women suffer from. Normal epithelium, a few abnormal cells. The cells are getting more and more abnormal, and there's more and more of them. And then true cancer when it starts to move into the adjacent tissues. The treatment for this is generally called conization. You take a kind of a hot wire, and the cervix is shaped like the top of an ice cream cone, and you cut around like this and pop out a cone-shaped piece of tissue that contains all the cancer cells. And the hot wire cauterizes the cut at the same time it does it to help stop bleeding. Anything can become cancerous. I mean, there's virtually nothing that can't. Vaginal cancer, not particularly common. Vulvar cancer, the external genitalia. Endometrial cancer, the inner lining of the uterus. And ovarian cancer, which is more common, more on the line with cervical cancers, and also related to the HPV virus. Moving to a different category, sexual dysfunction is a relatively common problem in the United States. It can be everything from an inability to want to have sex, which is damaging for relationships, to actual diseases or painful intercourse that make it virtually impossible. Inhibited sexual desire is a decreased libido. In other words, I don't want to anymore. Vaginismus is a spasm of the vaginal muscles during intercourse that makes it very painful. Anorgasmia means that the person, male or female, is unable to achieve an orgasm. And dyspareunia, painful intercourse. I always remember this when I tell my medical terminology. It's painful to think of your parents having intercourse. Dyspareunia means painful intercourse. It can be a variety of reasons. You can have scarring, you can have an infection, you can have genital herpes or something in there that causes ulcerations of the vaginal wall. Women after menopause tend to get dry, and that can cause painful intercourse. The vaginal wall can atrophy some. Once it's not needed anymore for reproduction and you stop producing estrogens, then the vaginal wall gets thinner and it can become lacerated or ulcerated during intercourse and be very painful. There are vaginal creams that contain estrogens that revitalize those cells and it doesn't hurt anymore. Some side effects from taking estrogens, the same as taking estrogen replacement therapies to keep your bones strong. There are some difficulties or problems, so you have to weigh the cost benefits. Impaired fertility means you can't get pregnant. And theoretically, it's after a year of having unprotected intercourse with that same partner, then if you haven't gotten pregnant, one partner or the other has a fertility problem. The male can have a low sperm count or sperm that are immotile, they don't swim very well. The female may not ovulate properly, may not produce a healthy egg. She may have a blocked fallopian tube so that the egg can't move down to meet the sperm. So you have a blocked fallopian tube, hormonal problems that don't allow the maturation of your follicles, the sperm or the ova. Or you have a hormonal problem that means the endometrium either doesn't mature properly during that month or it sloughs off too soon. Some things that go wrong with the male reproductive system: urethritis. The urethra is longer in the male. It doesn't go just from the perineum to the bladder like it does in the female. It has to go the length of the penis through the prostate and up into the bladder. So there's more room. First of all, it prevents some infections from making it all the way into the bladder, so that's a good thing, I guess. But you have more urethra to go wrong. So you can have an inflammation, urethritis. It may be from sexually transmitted disease or infection of some kind, or maybe just really bad hygiene. Insertion of things like catheters and whatnot could cause problems. Urethral strictures happen when there's prolonged inflammation, infection, damage from some something being inserted or whatever, and it causes scarring and closing of the urethra so that it's hard for any urine to go through. Phimosis, and this is a problem that male babies can have, and that is the foreskin doesn't retract, doesn't open far enough for the glans penis, the head of the penis, to move through. And so it's stuck inside the foreskin. And paraphimosis is when the foreskin has come back, but now it won't go forward again. Usually, it can be a genetic abnormality that is easily treated with a circumcision in a male baby, or even a widening of the foreskin, the prepuce. In an adult, it's usually because either a sexually transmitted infection or poor hygiene has caused infection that has caused swelling and scarring of the tissues. Peroni disease, bent nail syndrome, is a condition in which the connective tissue on one side of the penis overgrows and contracts and pulls the penis off to one side, making intercourse virtually impossible. Priapism, our famous picture of the Greek god Priapus, who had to have a crane to hold his penis up because his erection was so huge. And this is the condition of the erection that lasts more than 4 hours. It's actually a condition that can cause serious damage to the penis because a full infection is so pressured that it blocks blood flow into the penis, and it can cause damage. Erectile dysfunction drugs like Viagra. Balanitis. Balano is the glans or head of the penis. That's the medical term. Balanitis is an inflammation of the head of the penis. Often uncircumcised males who don't clean out the prepuce, the foreskin, regularly, and you develop a layer of material in there called smegma, and it harbors bacteria and can cause inflammation and infection. And penile cancer, testicular cancer is relatively common, very treatable. Penile cancer is fortunately very uncommon because it's quite lethal. 5-year survival rate's only 50% in men that get penile cancer. The term seal means hernia or herniation. So an enlargement, stretched out, herniated, fluid-filled thing, would be a varicocele or like varicose veins in the scrotum. A hydrocele is a increased fluid in the scrotum itself, causing it to swell up painfully. The varicocele, you can often remove the actual vein that was varicosed. Here, they do a centesis and remove fluid. Spermatocele, the sperm duct and the epididymis may become engorged and overfilled with fluid. Cryptorchidism, interesting term. Ism means a condition. Orchid is a term for testicle. And crypt means hidden, like in a crypt. So cryptorchidism is an undescended testis. So when you're born, the testes are still up usually in the pelvic cavity where the ovaries are and where the testes started out, and they're supposed to drop through the inguinal canal into the scrotum. If they don't, if they stay up behind here, it's cryptorchidism, and with drug therapy or manipulation or surgery, you have to move the testis down into the scrotum. Testicles do not function if they're not down in the scrotum. The scrotum actually controls temperature that allows the sperm to mature and survive. Orchitis, the same term as orchidism here, is inflammation of the testicle. Mumps, especially in adults. Mumps in kids usually are relatively benign. Mumps in adults are more likely to be kind of serious. Testicular torsion, twisting of the testicle inside the scrotum. It's very painful, and it can cause a blockage of blood flow that can kill stuff. Surgical emergency for that reason. And testicular cancer, we've known some fairly famous people that have gotten over that, whether it was Scott Hamilton. Yeah, Scott Hamilton. He was the figure skater, gold medal figure skater, who rather famously recovered from testicular cancer. So it's quite treatable. It's a fairly young person's cancer. Inability to produce decent sperm is likely a result of hormonal imbalances. LH and FSH. Okay, LH causes your Leydig cells to make testosterone. Testosterone is required for maturation, proper maturation of the testes and the rest of the male apparatus. Follicle-stimulating hormone stimulates the follicles to develop. From the Sertoli cells, the little sperm tids, the primordial sperm, move down toward the tubule, grow a little tail, mature, break off, and become mature sperm. But there is a particular sequence of events that has to take place, and inability to produce or respond to these hormones is going to cause a reduction in viable sperm. Sperm count below 20 million usually causes infertility, almost always. That's per milliliter. Now you would think 20 million would be plenty. That would be a lot. But as it turns out, it takes a whole lot of sperm starting to get just a few to reach the egg, and then it takes several to actually penetrate the wall of the egg. So it really does take a lot of sperm to cause fertilization. Most men are somewhere between 60 and 100 million sperm per milliliter. You can also have a genetic abnormality that doesn't allow the flagella to form properly. So the sperm would be okay, except it doesn't swim well enough. We can always have autoimmune problems. We actually can produce antibodies that attack your own sperm. What a great idea. Epididymitis, inflammation of the epididymis. Remember, the seminiferous tubules produce the sperm. It stores in the epididymis until it's time for delivery. This would be a serious infection of some kind, moving all the way up the urethra, back through the vas deferens, and all the way down to the epididymis on top of the testis. These don't look like they turned out so well. When you see them sitting on a table, it's usually a bad sign. Prostate disorders are probably the most common problem that men have, especially as they get older. There are two things that are likely to occur. One is benign prostatic hyperplasia. It means that it's not cancerous. It's just swelling, and it pinches off the urethra where it's going right through the middle of the prostate and you can't pee. The other is prostate cancer. Obviously a lot more serious. BPH, or benign prostatic hyperplasia, occurs in almost all men to some degree after they pass the age of 50, 60, 70. It depends on who you are, how bad it turns out. It will grow an enlarged but smooth and soft prostate. And the digital rectal exam is still one of the best quick exams to see if you have prostate cancer. If you find you can't pee, you go and you have a digital rectal exam, because the rectum is right directly next to the prostate. And you can push on it and feel that it's nice and soft and smooth, even if it's enlarged. If it's normal size and soft, you say, that's not your problem. If it's enlarged and soft, you say, you have BPH. If it's hard and lumpy, you have prostate cancer. You also test for the prostate-specific antigen. The prostate is always releasing this particular substance in the blood, and it can be tested for, and a normal prostate will produce normal amounts of PSA. And so it's a very common exam that guys have to see if they have prostate cancer, because if it goes way up, it's an indication of prostate cancer. However, it could also indicate an enlarged, inflamed prostate that's not cancerous at all, because anything that goes wrong with the prostate causes the PSA to go up. And having the prostate removed for, BPH or something is not a benign process. Men sometimes are incontinent. They have to wear Depends because they can't stop peeing. Sometimes they have erectile dysfunction. They become, inability to have sex anymore. So you don't want to have it out unless you have to. Prostatitis is a scary thing that happens to guys when they reach about 50 that convinces them that they probably have prostate cancer. You get an inflamed, kind of granular prostate that makes it burns a little bit to pee, and you're likely to have some blood either in your urine or your semen. It tends to go away on its own when, but you have to, most guys will go and have some kind of a test to see if they have prostate cancer. Similar symptoms to BPH. And then good old prostate cancer. About a third of all cancers in males is prostate cancer. It's usually a cancer of old age. It's a very slow developing cancer. So if you're 90 and you find out you have prostate cancer, you usually don't do anything about it because you're going to die before it does you in anyhow. Similar to BPH, it swells and hardens and makes it hard to pee. Improper hormone levels. There are some dietary factors that predispose you to prostate cancer, and there are some dietary changes that you can make to sort of starve the cancer, to limit the hormonal changes. Vasectomies make you slightly more likely to get prostate cancer because it causes kind of a backing up of fluids. Chronic inflammation, so if you have prostatitis for a long time, inflammation predisposes to cancer, so it's not a good thing to have for a long time anyway. But if you really have prostate cancer and it's growing, and especially if you're relatively young, you've got to have a prostatectomy. Have the prostate taken out and live with the consequences. I had a good friend in USA Volleyball with me, older than me, but he got prostate cancer and he was in his 70s, and it killed him at about 82, and it was not a good cancer death. So it can be totally serious. Again, PSA goes up. A lot of false positives, though, because it'll go up with prostatitis and some other inflammatory type conditions as well. And if you listen to the TV ads, you would think every male in the United States has sexual dysfunction. Even the guys that look like Fabio out on the beach running along, you know, they have to take Viagra or they can't get it up. Well, erectile dysfunction affects most men at some time or another during their lives. It's usually episodic. Sometimes, though, especially as men age, it becomes harder and harder to either achieve or maintain an erection. So vascular disorders, your blood vessels don't work as well as they did. Endocrine, you don't make as much testosterone as you used to make. Chronic diseases such as diabetes, some drugs, iatrogenic factors, medical treatment. Beta blockers are supposedly inhibitory for erections. Medical and surgical treatments, unblock whatever's blocked, take Viagra or Cialis. They cause nitric oxide production, which is a dilation, a vasodilator that allows more blood into the corpus cavernosum on the upper side of the penis that fills up when you have an erection. Disorders of the breast are everything from inflammation, leaky breast, all the way to breast cancer. The term rhea means flow. Galactorrhea means flow of milk. Galactorrhea in a female means flowing milk when it's not supposed to. Now, if you're pregnant and you're nursing, there will be times that milk comes out when you wish it wouldn't, when the baby is not there. True galactorrhea, if you're really not nursing, it's not supposed to be coming out, you may be leaking a little bit. It's generally caused by maybe an overproduction of prolactin or oxytocin. Prolactin causes you to make extra milk. Oxytocin is a muscle contractor that helps cause the milk to come out. So you could have a slight hormonal imbalance. Galactorrhea, overproduction of prolactin causes amenorrhea sometimes. It's harder to menstruate while you're nursing. You know, it's better for you to wait till you're through nursing before you have another baby. So if you're overproducing prolactin, you may have menstrual abnormalities of some kind. Galactorrhea can occur in men if they have inflammation or if they have some hormonal imbalances themselves. And galactorrhea happens in babies of both genders shortly after they're born, because mom just had this big surge of prolactin so she can start making milk for the baby. The baby gets some of that prolactin and they come out and their breasts are leaking milk. Witch's milk. Fibroids, fibrous breasts, fibrous benign lesions, whatever they're called, when you have a mammogram and you see all of these things like this, it makes you think you have breast cancer. But many women have extra fibrous tissue. It kind of holds their breasts together. And you can, so you can have anything from just diverse or diffuse fibrosis to an actual kind of fibroid in there, which is benign. It's very unlikely to become cancerous. You can leave it there unless it bothers you too much. Hyperplasia of various tissues, inflammation and fibrosis of the ductal mechanism, papilloma, a little encapsulated papule inside the ductal mechanism too. Sclerosing means it gets hard, so you would have a hardening of part of the breast. And breast cancer is unfortunately very common in Western society and Western women. Leading cause of death between ages 40 to 44. That's a lot, more than car accidents. Second most common killer after lung cancer. So lung cancer is a wider age span, but lung cancer doesn't kill very many 42-year-olds. It tends to kill people in their 60s and 70s. Black women are slightly more likely to get it, and you can see why this looks a lot like that, but it is a kind of crab-like, invasive-like tumor, and you can see that this would be hard to remove the tumor because it's kind of dispersed. And this looks like they put a contrast medium in it. Cancer tends to grow a lot of its own blood vessels, and it will suck in contrast medium because it is so well vascularized. And so if you do that, it'll shine compared to the other fibrosis in there that is not cancerous. We win, we win. Look, breast cancer. New cases per 100,000 people. Look, America. And then you have the Netherlands. And then you have Sweden. So breast cancer is very common in the Northern European and American type populations. Now, how African Americans fit into that doesn't quite make sense. It doesn't seem like they get it as often, but it's more lethal when they do. Maybe because they tend not to have as good of health care and they don't find it as early. That might be the biggest thing there. But here you have, down here, Japan and China are way down on the list for breast cancer. Risk factors. Reproductive. Having kids and nursing is a good way to avoid breast cancer. Being childless or having kids and never nursing actually raises your risk of having breast cancer. late set of menarche. So the longer you're in your reproductive years makes a difference. Hormonal factors, if you either produce excess estrogens or you take supplemental estrogens later in life, it increases your chance of having breast cancer. Radiation, if you've had radiation therapy for some other problem, it increases your chance of having breast cancer. Diet high in saturated fats increases your chance of having breast cancer. Chemicals, some of that were in plastics, but also a lot of broiled meats, charbroiled, charcoal, grills and stuff, increase your chance of having breast cancer. Now, that's a bummer. A lot of people like to grill, and when you grill, you have a tendency to grill meat, and therefore you have saturated fats. That doesn't mean you're going to get breast cancer, but all of these things increase your chances. Lack of physical activity, sedentary lifestyle increases chance of heart disease and breast cancer. And of course, inherited factors. Having the oncogene, the breast cancer antigen 1, the breast cancer related gene, and others. There are more sophisticated genetic tests you can do, not looking only for the BRCA1, but also for other genetic abnormalities. Obesity. So lack of physical activity and obesity, they're not the same. You can be a skinny couch potato, or you can be a heavy exerciser, but if you're a heavy couch potato, you're putting yourself at greater risk for sure. Signs and symptoms, generally painless to start with at least. The skin either can poke out or dimple. It's more likely to actually dimple and sink inward. Edema, swelling just from increased fluid. Surgical treatment, radiation therapy, chemotherapy. Biologic therapy. They're doing a lot with biologic therapy these days. What it tries to do is get your own immune system to do its job better. Our immune system is always fighting cancer cells in our body, usually successfully. A cancer cell is an abnormal cell. Abnormal cells are supposed to apoptose. If they don't, our immune system is supposed to kill them for us. The trouble is, our cancer cells, since they're our own cells, even though they're abnormal, they're smart enough to hide from our immune system pretty well so that our immune system can't recognize them as abnormal and kill them. Biologic therapy is creating antibodies specific to that cancer so that the antibody goes and attaches and says, hey, immune system, come here and eat this cell. So there are a couple of ways that you can do it. You can either try to put an antigen on the cell so that you recognize it anyway, or you put an antibody on the cell that will attract the rest of the immune system. Shows great promise. Bone marrow transplantation. If you're unable to produce enough of your own immune cells, you might need a bone marrow transplantation. Furthermore, when you take chemotherapy, it tends to kill off your bone marrow. So if you're having really serious chemotherapy, some people will have samples of their bone marrow taken out ahead of time. They have the chemotherapy, and then they inject the healthy bone marrow back in there to restore itself. Male breast disorders. Men can have breast cancer. That's way less likely than females, but males do have breasts, and so they can get breast cancer. Gynecomastia is a relatively common condition for men who produce more of the prolactin-type hormones than the average guy and wind up growing breasts that are a little bit more female-like. And what about sexually transmitted diseases, STDs? Now more commonly called STIs, because, for instance, you can have the HIV virus, so you have a sexually transmitted infection, but it's not a disease if you haven't shown any signs and symptoms. So if you don't get AIDS, you don't actually have the disease, but you have the infection. So STIs is probably a more accurate way of describing it. STIs, it's a tough field. Some things don't get reported. Other things people are embarrassed to report. They go to the doctor and it never winds up getting reported. They get something for it, or they get it over the internet or whatever. So it's a little hard to have a really good sense of what's going on with STIs. But we know that they're kind of on the increase. You know, people think they can always treat it, and therefore they're not especially careful. STIs may cause pelvic inflammatory disease, which is serious and can leave you infertile. Can cause ectopic pregnancies because swellings don't let the egg go through, and it gets fertilized and it starts growing in the fallopian tube. STIs, the bacterial kind, generally can be cured, and viral infections are mostly treatable, but so far we don't have a viral STI that is curable. HIV, you can take drugs the rest of your life that allow you to live. It's a lot of drugs, it's really expensive, it's not a great thing to do. It's not like saying, it's no big deal. Don't get HIV. You get genital herpes. You can't ever get rid of it. You can treat it so you don't have breakouts as often, but you can't actually cure it. Human papillomavirus can cause cervical cancer. Once you got it, it's treatable, but it's not curable. Better to take the vaccine and not get it in the first place. Chlamydia is the most common STD, STI. It's a bacterial infection. It's very treatable if you aggressively treat it quickly. But if it's untreated, it can cause all sorts of damage to the reproductive system, including infertility, ectopic pregnancy, scarring of the fallopian tubes, leading cause of blindness worldwide. And you may not know you have it at first. It also causes, it and gonorrhea cause some GI tract signs and symptoms too. Bacterial vaginosis, it's often an STI, especially in somebody who's very sexually active, but it could just be to poor hygiene, infection of the vagina, and it can move up into the uterus. Here's chlamydia again. Healthy cervix, chlamydia, this white covering over it, inflammation, scarring. infections or inflammation of the urethra, the kidneys, the vagina, the mouth, and the back of the throat. Usually caught through intercourse, or in the case of babies, caught as they pass through the vaginal opening of their mother who has it at the time of childbirth. Gonorrhea, also STI, also has a tendency to manifest itself in the back of the throat, down the esophagus, GI problems. It's a gram-negative bacteria. Remember what that means? It means they have that hard coating on so they don't take in the gram stain. It means they're a little harder to kill. Burning on urination, discharge, painful defecation, feels like you have hemorrhoids. Bacterial infection, so it's treatable, usually. Syphilis, also bacterial. Now, up until about the time of World War II, we didn't have antibiotics. And so these things weren't really treatable back then. And syphilis was just grim. A lot of Native Americans got syphilis when the white man came over and brought a lot of disease along with him. A lot of syphilis in jail populations. And huge lesions. There's a long latent period, so people didn't know they would have it for a while. And then they would start getting lesions. Look, it eats holes in the skull. People would go insane from it. Fatal if not treated long term. But it is treatable now with antibiotics. So people shouldn't get to this point. Of course, people around the world who don't have access to antibiotics are still at big risk, big time risk. Primary syphilis, hard lumps and kind of ulcerations. Secondary, it moves into, it becomes more systemic. You feel like you have a bad case of the flu. And tertiary is when the tissues start to eat away. Destructive manifestations, damage to nerves, damage to the brain, damage to the bone. Your viral infections are human papillomavirus, herpes, and HIV. Those are your main sexually transmitted viruses. Most common viral STI in the US is human papillomavirus. It actually causes warts anywhere, but transmitted sexually, you wind up with essentially genital warts on the vulva, inside the vagina, on the head of the penis. Young people get it, more sexually active, with different partners whose background they may not know very well. Cervical and vulvar cancer, some cancers of the penis and anus in men. And kids can get it, babies can get it during childbirth if the mom has it. Genital herpes, very common nowadays. If you get it, you got it forever. It may go dormant for long periods of time, like the herpes zoster virus, which goes into the nerves, and then pops out and gives you shingles at some point in your life. Blisters that look like cold sores on the penis around the vagina, the vulva, the anus, the peritoneum. Almost all genital herpes is simplex 2. Herpes simplex 1 is generally cold sores. Simplex 2 is generally genital herpes. Herpes simplex 2, genital herpes. And then herpes zoster is shingles. You can get it on the way out if you're a baby being born to a mother who has it. And there are treatments, but there's no cure. Latent stage for long periods of time, stress, excessive sunshine. You know, people get cold sores when the weather changes and they go out in the sun a lot and they get a cold sore on their face. So herpes simplex 1 or 2 can be kind of inspired by that sort of change. Generally, if you have it but have no vesicles at all, you won't transmit it to somebody. The thing is, sometimes the vesicle can be so small it may be unnoticed. And so you could pick up the virus from somebody who doesn't know that they're transmitting it to you. And HIV, the most lethal of all these, unless it's completely treated with antivirals, as it can be these days. Sexually transmitted parasites are generally mites and lice. Pediculosis are lice. The louse, we talked about it. Losis louse kind of sounds the same to try to remember what it is. Lice are visible. They don't burrow. They just bite you like a tiny tick or flea does. And pediculosis pubis is the sexually transmitted kind, also called crabs, because the crab louse is the one that's being transmitted back and forth from mild to intolerable itching. And scabies or mites can also be transmitted. If you have mites during sexual intercourse, direct contact with the skin, a good way to transmit them to a partner. And these do burrow in and lay eggs inside your skin, as we mentioned before. A little protozoan, which is therefore it's not a bacterium or a virus. Instead, it's a parasite. And this is trichomoniasis. Tricho means hair. You can see they look like they have hair, so they gave them this tricho name. Trichomoniasis is a protozoan transmitted. More women have problems with it than men. It's relatively not serious, and it's fairly treatable. It's uncomfortable and kind of grim to think that you have parasites growing in you, but doesn't tend to cause infertility. That finishes up the reproductive physiology part.